This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, my name is Jason Crowell from Norton Neuroscience Institute in Louisville, Kentucky. Thanks for listening to today's Neurology podcast. I'm very excited to welcome Fred Schaper today. Fred is a researcher with the Center for Brain Circuit Therapeutics at Brigham and Women's Hospital. And we invited him today to talk about a paper of which he was a co-author that was published in JAMA Neurology on July 3rd. The title of this article is Mapping Lesion-Related Epilepsy to a Human Brain Network. Fred, thanks for joining us today.
Thank you so much for inviting me.
We have done several of these interviews on brain networks and connectomes over the last few years, many of which highlight the work from Mike Fox and your group in Boston. The most recent interview that I could find was with Mike back in April of 2022, and Jeff Ratliff discussed with him the association between brain networks and sites of deep brain stimulation in individuals with Parkinson's and cognitive decline. So today we are venturing out of the movement disorders silo to talk about epilepsy and brain networks. So Fred, I admit I'm not an epileptologist, so please bear with me as we go through your paper here. Let's start with the key question that your paper addresses, and then we'll work backwards from there. So does lesion-related epilepsy map to a specific brain network?
That may seem like a strange question, but the question why lesions to some brain locations cause epilepsy and others don't has actually been unresolved for many decades. And in this study specifically, we used a wiring diagram, like you mentioned before, to map these common brain network connections. And at first, we were not expecting to find any common brain network connections, but we were very surprised that we actually did.
And I want to make sure that we're talking about the right topic here. So this paper was not designed to address the question of all types of epilepsy, right? As you specified, this is dealing with stroke-related epilepsy, is that right? So people who had a stroke and then went on to develop post-stroke epilepsy, the question was, is their epilepsy related to a specific network? Is that right?
Correct. So the first data set we analyzed was a data set of post-stroke epilepsy. And then we found generalizable findings, actually, epilepsy after penetrating head trauma, glioblastoma multiforme, tuberous sclerosis, and hematomas. So we used different lesions and lesion etiologies that can cause epilepsy and looked at the connections that are related to epilepsy.
So what did you find when you looked at these different types of lesion? What did you find in terms of network relationship?
We found that lesions causing focal epilepsy map to a common brain network. And the hub of this network was actually anti-correlation to the basal ganglia and cerebellum, which are regions that have been involved in seizure modulations in animal models and some experimental human studies since the 1950s.
How were you able to determine that injuries to different areas in the brain all had this network in common?
So what we used was a normative connectome, which you can compare with a wiring diagram of the human brain. And we then looked at specifically what location in the brain was lesioned and used that wiring diagram to compute the brain network connections of that lesion. Now, if you do this for each independent lesion, and in total, we had around 1,500 lesions, and then statistically test which network connections are common between the lesions that cause epilepsy and the ones that don't, you can map the common brain network connected to lesions causing focal epilepsy.
I know this is somewhat speculative, but does this suggest that there might be some commonalities in regards to treating post-stroke epilepsy that would be relevant? Say if you knew that your patient had a lesion in a certain area of the brain that was affected by this network, then that could potentially guide treatment decisions in regards to treating their epilepsy?
Correctly. So at first, the major clinical implication of this, let's say, brain network map would be that you use this brain network map and then overlap the lesion of a new patient on this network map to see how much overlap there is with this network. Potentially, you could then stratify patients into what is their risk of epilepsy after a specific brain lesion. That can be a stroke, a tumor, or a different brain lesion.
And also, kind of as a corollary to that, I know that a lot of Mike's work and the group that you're with in Boston is in regards to modulating these networks. So not just discovering the commonalities, but figuring out ways to adjust those. So I suppose this could also potentially suggest that some kind of neuromodulation treatment apart from medications could be used to treat epilepsy if an individual was found to have epilepsy that was involved with one of these networks. Is that right?
Definitely. So the interesting thing that we saw was that networks distant from the lesion location may have a causal role in the cause of focal epilepsy because these brain networks were not around the seizure focus. They were distant in the basal ganglia and cerebellum. The next thing what we did was test whether deep brain stimulation sites that we know can modulate seizures are also connected to this network or not. And we did that by using an independent data set that I studied during my PhD of anterothalamic DBS for focal epilepsy. And what we found is that when DBS sites are more connected to this network deep in the brain, in the basal ganglia and cerebellum, patients do better after DBS and their seizures are more controlled. So this suggests that this network may guide brain stimulation therapies for drug-resistant epilepsy.
Great. So looking forward, Fred, do you see a way that this could be used in the clinic in the coming years in terms of managing patients with epilepsy from one of these lesions?
Yes. So this is not a clinical tool yet, but we are working towards one. And one potential implication could be is that you use this as a risk map to estimate someone's risk of epilepsy after a lesion. And we are now collating more and more data to make lesion etiology specific maps, for instance, for post-stroke epilepsy. And the other way that this could translate to the clinics, which we're currently testing at the Brigham and Women's Hospital, is whether we can use this map as a guide for brain stimulation. For instance, when patients with deep brain stimulation do not respond to therapy as much as we hoped, we could see if a contact in a different location overlaps more with this network and may thus result in better seizure control. We are learning more and more about what brain networks cause and control epilepsy. And traditionally, it has been focused more on where is the focus, where is the one single spot that starts spiking or causes the seizure. And I think these results suggest that we should look at a wider brain network that may modulate actually this focus and the likelihood of it seizing. I think that's probably where future studies could really help, including animal studies that may look for a role of these regions and this network in epileptogenesis.
Yeah, I'm glad you said that, Fred, because I'm thinking back to when I was in training, and I can remember talking through patients with epilepsy and trying to correlate their clinical event, so where the seizure seemed to originate from based on their clinical manifestation, with whether or not there was any imaging abnormality, with where the seizure seemed to originate on EEG. And as we understand more and more about these connectomes, it seems like maybe we're thinking too narrowly, right? Like maybe it's really a network. And so if you think about all of these different areas being interrelated, then maybe we're focusing too much just on one aspect of this broader network.
Definitely. So seizures are spatiotemporally dynamic. So it's very complicated to map these networks. But I do think there is a role here for basic neuroscience and also clinicians to come together and try and map these epilepsy or even seizure networks using either wiring diagrams or real recordings from patients with specific semiologies.
Terrific. Well, I really appreciate you joining us today and talking about this paper. These connectome papers that are coming out are just so fascinating as we understand just how complex the brain is and understanding that it's even more complex than we realize. So thanks for joining us today, Fred. Really appreciate it.
Thank you so much, Jason.
Again, to our audience, the title of this paper is Mapping Lesion-Related Epilepsy to a Human Brain Network. It was published on July 3rd in JAMA Neurology. It's available online now, and thank you for listening to today's Neurology podcast.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.